What I want to talk to you today is a little bit more about the abstract which we put in, which was the effects of information about fetal movements on stillbirth rates in Iowa.
Dr. Hiesel studied 4 Midwestern states from 2005 to 2018 to see if there was any change in their stillbirth rates. He wanted to know whether Count the Kicks, a stillbirth prevention program that began in Iowa in 2008, had an effect on Iowa's stillbirth rate. Dr. Hiesel compared Iowa to neighboring states Minnesota, Illinois, and Missouri, 3 states that did not have a comprehensive statewide stillbirth prevention program for much of the study period. Here's a look at the time frame studied. Illinois and Missouri began implementing Count the Kicks very late in the study period. To date, Minnesota has not implemented a comprehensive statewide stillbirth prevention program like Count the Kicks.
For years in Iowa, we've seen the stillbirth rate going down, about 32% in a decade, while the rest of the country has remained stagnant. And so for the first time, a global stillbirth researcher, Dr. Alexander Hiesel, is examining what impact Count the Kicks has had on that reduction.
When we look at the stillbirth data from 2008 to 2018, what we see is that there's a reduction in the stillbirth rate in Iowa, which we don't see in the 3 neighbouring states that we looked at the same time. Being able to demonstrate that we've got a rate going down at 1% every 3 months in Iowa, so that's much faster than the United States population average, that tells us that something's happening in Iowa that isn't necessarily happening in the rest of the United States, and that's borne out by the fact we're not seeing a change in the 3 neighbouring states we analysed.
In the first time tranche from 2005 to 2008, this is a time period where none of the states had a stillbirth prevention program related to fetal movement monitoring. In 2008, Iowa launches Count the Kicks with the help of the Iowa Department of Public Health and doctors who believed Count the Kicks would work. You can start to see the promising decline. Dr. Hiesel says this is where Iowa starts seeing a 1% stillbirth rate reduction every 3 months. In the third time tranche, all states go up slightly, and in the fourth time tranche, the sharpest decline ever in Iowa. So what happened in that fourth time tranche?
This mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off.
In 2017, one Iowa mom and her doctor told the story about how the free Count the Kicks app helped alert her to red flags in her pregnancy. Their words were so powerful, they reached more than 350 million people across the globe. Count the Kicks app downloads shot up 3,700%.
It's now become standard of care, certainly a community standard of care here in Iowa, that physicians provide this information to their patients at 28 weeks. And if you don't do that, you're practicing outside the standard of care. So in my opinion, you're actually putting yourself at more risk as a provider for malpractice if you're not engaging Count the Kicks and not engaging that discussion with the patient.
To me, it's a no-brainer. It's like you hear this, it's such a simple message, and yet the science behind it is there. And then when you look at this new research, it's like, once again, telling you of this is so important.
The risk factors that increase your risk of stillbirth, so things like obesity, age, diabetes, high blood pressure, all of those things actually got worse between 2008 and 2018. So we can't really attribute the change, kind of the stillbirth rate in Iowa got better despite those risk factors going up rather than the other way around. That actually awareness does not in itself increase the caesarean section rate. What it aims to do is to empower women so that the right women go to hospital at the right time. Because if women go to hospital and their non-stress test is fine and their ultrasound's fine, well then they don't need a section. And I think what's really important was when in the majority of studies that I'm aware of, where people have asked women and pregnant mums what it is they want, the overwhelming majority of them want more information about baby movements, not less. The data that we've been able to obtain from studies suggests that anxiety goes down rather than up. And that's about empowering and educating women.
It's only when you ignore that patient, it's only when you don't have that discussion with that patient at 28 weeks and tell them about how important it is to monitor the baby's activities, that's the only time, in my opinion, that you may expose yourself to some increased risk for malpractice. This new study, I think, is going to be very helpful in convincing the last few naysayers out there. I would argue that the majority of obstetricians and midwives who are caring for pregnant women have adopted the Count the Kicks idea of moms helping to monitor their own baby's activities.
It's really important that we look at that in the context of the American stillbirth rate. So we know that the United States of America has one of the highest stillbirth rates in high-income countries, and also, sadly, one of the lowest rates of improvement. So overall, the United States stillbirth rate is only going down at 0.8% per year. Other countries are getting better, and you're not getting better as fast. So being able to demonstrate that we've got a rate going down at 1% every 3 months in Iowa, so that's much faster than the United States population average, that tells us that something's happening in Iowa that isn't necessarily happening in the rest of the United States. I think the best data we have at the moment is that, asking mums, making sure they know what to do if their baby's not moving normally, and having a balanced approach when they come to hospital is the way forward.
I would ask all providers in the obstetric world, whether you're a generalist, OB/GYN provider, whether you're a midwife provider, lay midwife, otherwise, whether you're a high-risk maternal-fetal medicine provider like myself, to take advantage of the information that Count the Kicks has available to you to provide your patients and help everyone decrease the incidence of stillbirth, one of the most tragic occurrences that we all have seen and experienced, because it's still happening in too great numbers. It needs to become a rare event. It's still a much too common event, and we can do more, we can do better.
If one baby's life is saved, it is definitely worth it.